Medications prescribed for neuropathic pain work by changing how your nervous system processes and transmits pain signals. They can calm overactive nerve firing or interrupt a signal before it registers. And of course, that's genuinely valuable. For many patients, it can mean the difference between sleeping through the night and being kept awake by burning, stabbing, or shooting pains. So today, we're not questioning whether these medications work, but we're examining what they were designed to accomplish and what a lower pain score actually tells us and what it leaves unanswered. Now, first, I want to make an important distinction. I am talking specifically about medications prescribed to control symptomatic neuropathic pain. I'm not talking about every medication a patient with neuropathy might be taking, because of course, some prescriptions directly address underlying drivers. That's going to include things like correcting a vitamin deficiency or helping to manage blood sugar. Now, those medications have a different purpose and are not what this video is about. The medications we are discussing are going to be anticonvulsants and antidepressant classes, as well as topical options used specifically for neuropathic pain. And although they work through different pathways, they share a central objective. They're intended to reduce the pain experienced by calming abnormal nerve activity or changing how pain signals are transmitted and processed. Now, that's a legitimate and clearly defined job, but it's a different job from restoring sensory function or improving the balance or functional deficits associated with neuropathy. When these medications work well, the effect on someone's life, of course, is so significant. Reduced pain often means better sleep. Better sleep can improve your mood, your energy, mental clarity, help you to exercise. When patients are not constantly fighting the burning, shooting, or electrical pain in their day-to-day life, their quality of life is going to improve. That's not a small benefit, and it should never be minimized. This video is not arguing that neuropathy medications don't matter, because they absolutely do matter. We are asking a more specific question. What does a better pain score actually prove, and what does it leave unanswered? Here's a clinical distinction that often gets overlooked. A pain score reflects the intensity of the patient's pain experience in that moment. It doesn't directly measure protective sensation. It doesn't measure balance, and it does not tell us everything about how the nerve is functioning. Pain, numbness, balance, all these impairments can all originate from the same underlying nerve damage. However, they can represent different patterns of dysfunction within that damaged sensory system. The nerve fibers involved in pain signaling can behave differently from the fibers responsible for detecting light touch, vibration, temperature, or joint position. That means pain can improve without sensation or function improving alongside it. A lower pain score tells us that the pain control strategy is working, and that's genuinely useful information, but it doesn't automatically prove that this neuropathy itself has stabilized or sensory function has improved. This is why pain should only be a part of the complete neuropathy evaluation. We could also be tracking protective sensation. Can the patient feel a cut, blister, or pressure point before it becomes a bigger problem? We should evaluate vibration and temperature perception. We should assess balance and gait. And we should monitor functional changes. Like, can the patient walk further? Are they more stable? Do they feel more confident on stairs or uneven ground? We should track the progression of the numbness. Is that stable? Is it improving? Or is it continuing to spread? And most importantly, we should investigate the underlying driver of that particular neuropathy. A patient can report significantly less pain while continuing to decline in one or more of those other areas. Pain control and nerve status are related, but doesn't really confirm each other. Circulation and metabolic stability are two factors that may influence the underlying driver, but they are not universal explanations for every patient. The contributing factors must be individually evaluated instead of just assumed. I also want to make a point about safety. Never stop or reduce a prescribed medication without speaking to the clinician who prescribed it to you. Nothing in this video is a recommendation to alter your medication regimen. If this information raises questions, bring those questions to your prescribing provider. Most patients taking neuropathy medication are not simply chasing a lower number on a pain scale. They want to sleep through the night, they want to walk more confidently, and they want to maintain their independence. They want to function without constantly thinking about their feet. Pain control can support all of those goals, but it was never intended to be the entire strategy. Medications prescribed for neuropathic pain are built to address the pain experience. They generally are not designed to address the broader nerve environment. The nerve environment includes the metabolic, vascular, nutritional, mechanical, and lifestyle factors that influence nerve health in that individual. That is a separate part of the clinical picture, and is a part that the pain-focused medication conversation was never designed to cover by itself. The strongest strategy is often a coordinated one. The prescribing clinician manages the medication and the broader medical picture. Additional evaluation can monitor sensation, balance, function, and the factors contributing to the neuropathy. These are not competing approaches. They are different parts of the same clinical picture. Now that's what the role of the 360 neuropathy system is. It's not a replacement for medication. It's a complementary care coordinated with your prescribing physician, focused on the areas that pain medication alone was not designed to track or address. Medications prescribed for neuropathic pain can be a genuinely valuable part of managing the condition. Better pain control always matters. Better sleep matters. Better quality of life is important. But here's a line I want you to remember. If your medication is working, but you're still losing sensation, still worried about falling, still watching the numbness spread, it doesn't mean the medication failed. It means pain control may only be one part of the strategy. Now, if you want a fuller picture of what strategy should include for your specific case, a consultation is a good place to start.